Have you ever woken up after a full night's sleep, but you still feel totally exhausted? It's such a common problem. But what if the issue isn't really about the amount of sleep you're getting, but the quality? Well, in this explainer, we're going to break down sleep apnea, what the different types are, and how you can finally get some real answers about your sleep.
You know that feeling, right? It's so frustrating. You go to bed on time, you think you slept for a solid 8 hours, but when that alarm goes off, you wake up exhausted. And we're not just talking about being a little groggy here. This is the kind of tired that can pretty much ruin your entire day.
So what is actually going on? Well, one of the most common and honestly most overlooked reasons is a sleep-related breathing disorder. And the crazy thing is, the clues are often right there, staring us in the face, but most of us just don't know what to look for.
And this is where you start to see a pattern. It's almost never just one single thing. Yeah, it could be loud snoring for sure, but it might also be waking up suddenly, gasping or choking for air, or those weird morning headaches you can't explain. That feeling of being tired all day long that you just can't shake, and even, noticeable changes in your mood or your ability to focus. These are the red flags you really want to pay attention to.
Okay, so this is where things get a little more specific. It turns out sleep apnea isn't just one single condition. There are actually 3 different types, and really understanding the difference between them is the absolute first step toward finding a solution that works.
And this is just a fantastic way to think about the core difference between the 2 main types. Picture it like this. One is a physical problem, like a roadblock in your throat. The other one? That's a communication problem, a missed signal coming from your brain.
So first up, we've got obstructive sleep apnea, or OSA. This is the one you've probably heard of. What happens is, when you fall asleep, the muscles in your throat get a little too relaxed, and your airway can narrow or even close off completely. Your body then kind of panics and forces you to wake up just enough, often with a gasp or a snort, to get you breathing again.
Then you have central sleep apnea, and this one is a whole different ballgame. With this type, there's no physical blockage at all. The problem actually starts in the brain. For whatever reason, it sometimes just forgets to send the signal to your muscles to breathe, so the pauses in breathing are actually starting from your central nervous system.
And then, to make things even more interesting, there's mixed apnea. And just like the name says, it's a combination of both. You could be dealing with physical blockages and those missed brain signals all in the same night. This is exactly why getting a proper diagnosis is so crucial. It can be a really confusing picture to sort out on your own.
So with all these different possibilities, I know it can seem a little overwhelming to try and figure out what's going on, but getting answers is actually way more straightforward than you probably think. Let's walk through the steps.
The path to getting answers really follows a clear plan. It all kicks off with you recognizing those red flags we talked about earlier. From there, the next step is usually getting a test, having a real expert look at the results, and then, finally, getting a plan that's made just for you.
And thankfully, the days of having to spend a super uncomfortable night in some strange sleep lab are mostly over. Modern technology now lets us do incredibly accurate, medical-grade testing right from the comfort of your own bed. This way, you can sleep in your natural environment while the device does all the work collecting the data.
And the tech behind these home tests is really pretty amazing. I mean, some of these devices are as simple as a little sensor you wear on your finger. But from that one tiny point of contact, they can gather all the critical data a specialist needs. We're talking oxygen levels, heart rate, breathing patterns, all to make a super accurate diagnosis.
So why is it so important to get the right diagnosis? Can't you just, try a standard treatment? Well, the short answer is no, and this next part is absolutely vital to understand.
This quote from our source really says it all. Correct identification guides treatment decisions. Think about it. A treatment that works wonders for a physical blockage in your throat might do absolutely nothing for an issue with your brain signals. Without the right diagnosis, any treatment is really just a shot in the dark.
And that's because the goal here isn't just to stop snoring. It's about getting real, effective, long-term relief that can completely transform your quality of sleep, bring back your energy, and ultimately protect your health from some really serious long-term risks, like high blood pressure and heart problems.
So this all brings us to the final and, I think, most important part: what you can actually do to get started on your path to better sleep.
So if there is one key thing to take away from all this, it's this. A one-size-fits-all approach just does not work here. Real, lasting improvement absolutely depends on matching the right kind of therapy to your specific diagnosis. Which really just brings us to our final question. If you've been waking up tired day after day and just wondering why, maybe it's time to stop guessing and start solving the mystery. Because after all, getting better sleep isn't a luxury, it's absolutely essential.